Welcome back to Mr. Teeth. Have you ever experienced a painful sore inside your mouth that makes eating, drinking, or even speaking uncomfortable? If yes, then you may have suffered from an oral ulcer, commonly known as a mouth ulcer or mouth sore. Many people develop mouth ulcers several times a year. Some heal within a few days, while others become so painful that they interfere with daily life. Although most oral ulcers are harmless and heal on their own, some can be signs of serious underlying health conditions. In today's video, we will discuss everything you need to know about oral ulcers, including their causes, symptoms, treatment options, home remedies, prevention tips, and when you should visit a dentist. What are oral ulcers? Oral ulcers are small breaks or sores in the lining of the mouth. They can occur on inner cheeks, lips, tongue, floor of the mouth, soft palate, gums. These ulcers are usually round or oval in shape with a white, yellow, or gray center and a red border around them. They can be extremely painful, especially while eating spicy or acidic foods. How common are oral ulcers? Oral ulcers are among the most common oral health problems worldwide. Studies suggest that approximately 20% of the population experiences recurrent mouth ulcers at some point in their lives. They are more common in teenagers, young adults, females, individuals under stress. Types of oral ulcers. 1. Minor aphthous ulcers. These are the most common type. Characteristics: small in size, less than 1 centimeter, heal within 7 to 14 days, usually leave no scar. 2. Major aphthous ulcers. Characteristics: larger than 1 centimeter, more painful, may take several weeks to heal, can leave scars. 3. Herpetiform ulcers. Characteristics: numerous tiny ulcers, often appear in clusters, very painful, may merge into larger ulcers. Causes of oral ulcers. Many factors can contribute to mouth ulcers. 1. Trauma. Physical injury is one of the most common causes. Examples include accidental cheek biting, sharp tooth edges, broken fillings, poorly fitting dentures, aggressive brushing. 2. Stress and anxiety. Emotional stress can weaken the immune response and trigger ulcers. Many people notice ulcers appearing during exams, work pressure, family stress. 3. Nutritional deficiencies. Deficiencies of vitamin B12, iron, folate, zinc can increase the risk of recurrent ulcers. 4. Hormonal changes. Women may develop ulcers during menstruation, pregnancy, hormonal fluctuations. 5. Food sensitivities. Certain foods may trigger ulcers such as citrus fruits, pineapple, tomatoes, spicy foods, salty foods. 6. Medical conditions. Recurrent ulcers may be associated with celiac disease, Crohn's disease, ulcerative colitis, Behçet disease, HIV infection. 7. Immune system disorders. An overactive immune response can attack healthy oral tissues and cause ulcer formation. Symptoms of oral ulcers. Common symptoms include painful sores inside the mouth, burning sensation, difficulty eating, difficulty speaking, sensitivity to spicy foods, redness around the ulcer. Some patients feel tingling or burning before the ulcer appears. Diagnosis. Most oral ulcers can be diagnosed through clinical examination. Your dentist may ask about duration of ulcer, frequency of occurrence, dietary habits, medical history, medications. Additional investigations may include blood tests, vitamin level assessment, biopsy in suspicious cases. Treatment of oral ulcers. Now, let's discuss the most important part, the treatment. The treatment depends on the cause and severity of the ulcer. 1. Removal of the cause. The first step is identifying and eliminating the source. Examples: smoothing a sharp tooth edge, adjusting dentures, replacing defective restorations, improving oral hygiene. 2. Topical medications. These medicines are applied directly on the ulcer. Protective oral gels. They form a protective layer over the ulcer. Benefits: reduce pain, protect from irritation, promote healing. Topical corticosteroids, used for recurrent painful ulcers. Benefits: reduce inflammation, speed healing, decrease pain. These should only be used under professional supervision. 3. Antiseptic mouthwash. Antiseptic mouth rinses help reduce bacterial load, prevent secondary infection, improve oral hygiene. Chlorhexidine mouthwash is commonly recommended for short-term use. 4. Pain relief medications. Pain management may include topical anesthetic gels, oral painkillers when necessary. These provide temporary relief and make eating more comfortable. 5. Vitamin supplementation. If laboratory tests reveal deficiencies, supplementation may be recommended. Common supplements include vitamin B12, iron, folic acid, zinc. Correcting deficiencies often reduces ulcer recurrence. 6. Treatment of underlying disease. If ulcers are caused by gastrointestinal disease, immune disorders, systemic illness, the underlying condition must be treated for long-term control. Home remedies. While professional treatment may be required, several home measures can help. Warm saltwater rinse. Benefits: cleanses the area, reduces irritation, promotes healing. Adequate hydration. Drink plenty of water throughout the day. Hydration supports tissue healing. Soft diet. Choose yogurt, soft rice, bananas, soups. Avoid foods that aggravate pain. Avoid trigger foods. Avoid spicy foods, acidic foods, excessively hot foods. Foods that help healing. Certain foods may support recovery. Examples include eggs, fish, milk, yogurt, green vegetables, fruits rich in vitamins. A balanced diet supports immune function and tissue repair. When should you visit a dentist? Many ulcers heal naturally within 1 to 2 weeks. However, seek professional care if ulcer lasts more than 2 weeks. Ulcer is unusually large. Frequent recurrence occurs. Severe pain develops. Difficulty swallowing appears. Unexplained weight loss occurs. White or red patches persist. Persistent ulcers should never be ignored. Can oral ulcers be oral cancer? Most oral ulcers are not cancer. However, a non-healing ulcer lasting more than 2 weeks should be evaluated by a dental professional because oral cancer can sometimes appear as a persistent ulcer. Early diagnosis significantly improves treatment outcomes. Prevention of oral ulcers. You can reduce the risk by maintaining excellent oral hygiene, using a soft toothbrush, managing stress, eating a balanced diet, avoiding tobacco products, correcting vitamin deficiencies, visiting the dentist regularly. Common myths about oral ulcers. Myth 1. All mouth ulcers are caused by heat in the body. Fact. Multiple factors including trauma, stress, nutritional deficiencies, and medical conditions can cause ulcers. Myth 2. Mouth ulcers are always infectious. Fact. Most common aphthous ulcers are not contagious. Myth 3. Every ulcer requires antibiotics. Fact: antibiotics are usually unnecessary unless a specific infection is present. Myth 4. If pain decreases, treatment is no longer needed. Fact: the underlying cause should still be identified. Conclusion: oral ulcers are common but often painful conditions that can affect eating, speaking, and overall quality of life. Most ulcers heal within 1 to 2 weeks, but recurrent or persistent ulcers may indicate an underlying problem that requires professional evaluation. Maintaining good oral hygiene, reducing stress, eating a balanced diet, and seeking dental advice when necessary are key steps in preventing and managing oral ulcers. If you found this video helpful, don't forget to like, share, and subscribe to Mr. Teeth for more dental health content. Thank you for watching, and take care of your smile.